Hello friends, welcome back to my channel. In this video, we will talk about alarming signs that your cholesterol is too high. High cholesterol doesn't cause pain. It doesn't give you a fever. It doesn't make you cough. And that's exactly why it's dangerous. Your arteries could be clogged right now. Blood flow could be slowing. Oxygen could be struggling to reach your brain or your heart, and you'd feel nothing. Until one day something snaps. A heart attack, a stroke, a moment that changes everything. But the body isn't completely silent. It whispers, it gives clues. Unusual signs you may brush off or blame on something else. These are not textbook symptoms, these are patterns, subtle changes, physical signals that something deeper is going wrong inside your blood vessels. In this video, you'll learn the 12 most overlooked signs that your cholesterol is dangerously high. Not the ones you already know. These are the warning lights most people miss, until it's too late. Sign 1. A gray-white ring around your cornea. Take a close look at your eyes in natural light. If you see a pale, gray, or white arc forming around the outer edge of your cornea, it could be more than just aging. This ring is called arcus senilis. It shows up when cholesterol-rich deposits build around the edges of the eye. In people over 60, it's fairly common and not always linked to heart issues. But if you're under 50 and you have it, that's a red flag. Several studies have found a strong link between arcus senilis and elevated LDL cholesterol, especially when combined with low HDL. It doesn't affect vision, so it's easy to ignore. But it's a visible sign of what may be happening inside your arteries. Cholesterol building up silently, narrowing blood flow. If you spot this, especially if you have other risk factors, get your blood tested. The eyes don't lie. Sometimes, they're the first place to reveal what your blood is hiding. Sign 2. Numbness or tingling in your legs or feet. If you're feeling pins and needles in your feet for no clear reason, don't ignore it. This isn't just poor posture or a cramped nerve. It could be a sign of poor blood circulation caused by clogged arteries. When cholesterol builds up in your blood vessels, it limits how much oxygen-rich blood reaches your lower limbs. The result? Numbness, tingling, or even burning sensations in your toes or feet. This isn't a one-time sensation after sitting too long. It's a pattern. It may come and go, or it may get worse during walking or at night. If it becomes regular, it's time to check your cholesterol. Peripheral nerves are highly sensitive to blood flow. When that flow is blocked or reduced, they misfire. That strange tingling may be your body's way of warning you before something more serious happens, like a blocked artery in your leg or even your heart. Sign 3. Yellowish bumps on the skin. Small, soft, yellowish lumps under the skin might seem harmless, but they can reveal a lot about your blood. These bumps are called xanthomas. They're made of fat deposits, especially cholesterol, that collect just below the skin. They often show up on the elbows, knees, ankles, or around the eyes. They don't itch. They don't hurt. And because of that, people often ignore them. But they're linked directly to very high levels of LDL cholesterol or inherited cholesterol disorders like familial hypercholesterolemia. If you notice these bumps, especially if you also have a family history of heart disease, take them seriously. They're one of the few outward signs that your cholesterol is not just high. It may be dangerously high. They won't go away on their own. But if you lower your cholesterol through treatment and diet, it may shrink or disappear. Sign 4. A heavy, tired feeling in the chest after activity. Walking upstairs shouldn't make your chest feel tight. If it does, even slightly, it could be a warning. As cholesterol builds up in the coronary arteries, it narrows the space for blood to flow. During rest, the heart gets just enough oxygen. But during activity, it needs more. If it can't get enough because the arteries are partly blocked, you may feel pressure, heaviness, or tightness in your chest. This isn't the classic heart attack pain. It might feel like discomfort, fatigue, or strain. You might think you're just out of shape, but it could be a mild form of angina, a chest discomfort caused by reduced blood flow. It's the kind of symptom people often ignore for years until one day, the artery closes off completely. If your chest feels unusually heavy during physical effort, don't brush it off. get checked. That little extra effort could reveal a big hidden problem. Sign 5. Frequent jaw or neck discomfort during activity. Chest pain isn't always the first sign of a clogged artery. In many people, especially women, discomfort shows up in the jaw or neck instead. If you notice soreness or tightness in your lower jaw, throat, or neck that comes on during walking or climbing stairs and eases when you rest, it could be a form of referred pain. Your heart is working harder, but blocked arteries aren't delivering enough blood, and the stress shows up in nearby areas. This isn't tooth pain. It doesn't get worse when you chew. It's more like a dull ache that doesn't quite make sense. That's what makes it dangerous. People often go to the dentist or stretch their necks, not realizing their heart is the real issue. Any unexplained pain from the chin to the collarbone that comes with exertion should be taken seriously. It might not be muscular. It could be vascular. Sign 6. Erectile dysfunction in men. Erectile dysfunction is often blamed on stress, aging, or hormones. But in many cases, it's the first warning sign of clogged arteries, years before any heart symptoms appear. An erection requires good blood flow. If cholesterol has narrowed the arteries supplying the pelvic region, that blood flow becomes weak or unreliable. This can lead to difficulty achieving or maintaining an erection. Research has shown that ED can appear 3 to 5 years before more serious cardiovascular events like a heart attack. That makes it a powerful early indicator. If you're under 60 and begin noticing ED, especially if you also have high blood pressure or belly fat, it's worth checking your cholesterol levels. The smaller arteries in the groin are affected earlier than the larger coronary arteries, so problems down there can point to bigger issues building up elsewhere. It's not just a bedroom issue, it's a circulation issue. Sign 7. Sudden memory lapses or poor concentration. Everyone forgets things now and then. But if you've been noticing sudden gaps in memory, difficulty concentrating, or mental fog that wasn't there before, don't just blame age. Your brain needs a constant supply of oxygen-rich blood. If cholesterol is silently narrowing the arteries leading to the brain, even a slight drop in blood flow can affect how clearly you think. This condition is sometimes called vascular cognitive impairment, and it can happen before any signs of stroke appear. You might struggle to find the right words, forget names more often, or feel mentally slow during conversations or work. These subtle changes can build over time. High cholesterol doesn't always scream for attention. Sometimes it just slows things down in ways you don't expect. If your brain doesn't feel as sharp as it used to, especially if you also have high blood pressure or diabetes, it's time to check what's happening inside your blood vessels. Sign 8. Visible cholesterol deposits on eyelids. Look closely at the skin around your eyes. If you see flat yellowish patches near the inner corners of your upper or lower eyelids, you may be seeing cholesterol that's moved beyond the bloodstream. These patches are called xanthelasma. Unlike xanthomas, which can appear anywhere, a xanthelasma is specific to the eyelids. It's soft, painless, and doesn't affect vision, but it is strongly linked to high total cholesterol and low HDL levels. It doesn't always mean you have heart disease right now, but it does point to an imbalance in how your body handles fats. Some people dismiss these patches as cosmetic, but they're more than skin deep. If you spot this, ask your doctor for a lipid profile. It's one of the few signs that lets you literally see the cholesterol trying to get your attention before it does damage inside. Sign 9. Unexplained pain in your calves when walking. You're walking at a normal pace and your calves start to ache. Not a cramp, not sore muscles from a workout, just a dull or burning pain that shows up when you move and goes away when you stop. This is a classic sign of peripheral artery disease or PAD. It happens when cholesterol buildup narrows the arteries in your legs, reducing blood flow to the muscles during activity. It's easy to mistake for simple aging, especially if the pain isn't severe. But the pattern is the clue. Pain that consistently appears during walking and disappears with rest is often vascular, not muscular. PD doesn't just affect your legs. It's a strong indicator that similar blockages may be forming in your heart or brain. In fact, people with PADI have a much higher risk of heart attack and stroke. If your legs talk to you every time you walk, it's time to listen. Sign 10. Fatigue that creeps in too early in the day. Everyone feels tired sometimes, but if you're constantly drained by mid-morning, even after a full night's sleep, your body might be working harder than you realize. When cholesterol narrows the arteries, your heart has to pump with more force to circulate blood. That extra effort demands energy. Over time, you feel worn out from doing simple tasks, like climbing stairs or walking across a parking lot. This isn't the kind of tiredness that goes away with coffee. It's a steady lack of stamina. You might wake up feeling okay, but run out of energy by noon. You may find yourself skipping activities, not because you're lazy, but because your body feels slower. Fatigue is easy to ignore because it doesn't feel urgent, but persistent, unexplained fatigue, especially if paired with shortness of breath or heaviness in the chest, can be one of the early signs that your heart and arteries are under pressure. Sign 11. Shortness of breath from minor exertion. You walk across a room, or you bend down to tie your shoes. And suddenly, you're out of breath. Not gasping, but noticeably winded, much more than you used to be. This kind of breathlessness, especially during light activity, can signal that your heart isn't getting enough oxygen. When cholesterol narrows the coronary arteries, even everyday tasks can leave your heart struggling to keep up. Many people blame this on aging or lack of fitness, but if it starts suddenly or gets worse over time, that's not normal. It's your heart sending out an early warning. When blood can't flow freely, oxygen delivery drops. The body compensates by speeding up your breathing, even during mild effort. This is not just lung-related, it's circulation-related, and it may be one of the final signs before a more serious cardiovascular event. If breathing feels harder than it used to, it's time to get tested. Sign 12. High blood pressure that won't budge. If you've been told your blood pressure is high and it's staying high despite efforts to fix it, cholesterol could be the reason. When plaque builds up along artery walls, the space for blood to move gets tighter. The heart has to pump harder just to push blood through the body. That extra pressure shows up on the monitor, even if you feel fine. This isn't temporary. It's mechanical. The narrowed arteries create resistance, and the body responds by raising pressure to maintain flow. You might be eating better, exercising, and even taking medication, but if your cholesterol is still high, the pressure won't fully come down. That's because the root problem hasn't been addressed. High blood pressure and high cholesterol often go hand in hand. Left untreated, they can do real damage to your heart, kidneys, and brain. If your numbers aren't improving, it's time to look deeper, starting with your lipid profile. So if any of the signs in this video feel familiar, don't wait. Talk to your doctor. Ask for a lipid panel. This isn't about panic, it's about prevention. And if you found this helpful, give the video a like, subscribe to VisitJoy, and share it with someone who might be ignoring the signs. Your attention today could change a life tomorrow.